Do you know how to register your local general practice? In this episode, I'm going to show you exactly how to do that quickly and easily using the 3 different methods, including the newest one, the NHS App. Let's tech enhance your primary care and learning. If this is the first time we're meeting, I'm Dr. Gandalf of eGP Learning, where I look at supporting you with technology-enhanced primary care and learning. And in this episode, I'm going to show you exactly how you can register at your local general practice using a variety of different methods, including the new one, the NHS App. As always, if you want to follow our content, make sure you subscribe by ringing the bell. This means you get notified first and foremost. And we're on all the various platforms like YouTube, Facebook, Twitter, LinkedIn, Instagram, as well as all the podcast methods and stuff. Always keen to hear your feedback. Shall we begin? Hi GP learners. In this episode I'm going to talk you through how you can register with your local GP practice. One way you can do that is by filling in what's called the GMS1 form. So this is basically the little contract that you sign with your practice, and you can do that in a variety of different ways. So number 1, you can fill in the form itself, and this is what it looks like. You can obtain this from your practice if you want, or you can go to the nhs.gov.uk website and as a result of that download it from there. Or actually another way maybe to engage with your practice website, because normally they will have a paper version of that you can download and print, and then you just give that to the practice itself. Nice and easy way of doing it, and there's not much information you need to give. Simply you need to fill in your patient details so they can track your records. Then need to fill in previous information, like for example your previous practice or previous residential address. Again, that's to try and make the process a little bit easier. There is a separate section if you're a veteran, because the healthcare services you get are different based on that process. If you're registering for a child, there's a box to tick in terms of whether or not you want them involved in child health surveillance, as well as there's a question about dispensing medications. And this is more relevant if you're in a more rural area or don't have access to a pharmacy, because your practice may be providing you with your medications because of dispensing arrangements. It's worth asking about this if this is relevant to yourself. It doesn't apply to all practices. The lower sections is quite a bit about organ donation and blood donation, whether you want to be on the registers for those. The back of the form, well, the top part is actually for the practice to fill in. It's your details and whether or not they agree to the contract, which majority of practices will. We'll come into situations where that may not happen in a second. And then the last part is about whether or not you classify as an ordinary resident. So effectively, if you are not resident in the UK all the time, or if you've come from abroad and are here for a short period of time, you will be eligible for general practice care, but you may not be eligible for free secondary based care or other services, and this is basically a mini contract that is designed on that basis. This isn't relevant to everybody, but if it is relevant to yourself, it's worth having a quick read so you understand what you can and cannot obtain in terms of healthcare. As I said, there may be situations where your practice may not be able to register you. Effectively, this may be if the practice list is closed, so this is when the practice has already more patients than it can currently cope with, and as a result of that, it's applied to have its list closed. That can be for a temporary or for a longer term basis. If that's the case, unfortunately, we'll have to find another practice. Another situation may be if you live outside of the practice area. So every practice has an area that they cover, and the best way to find this information, go on the NHS Choices website. If you put in your postcode, it will give you all the local practices in that area, as well as the ones that are open and closed, and also some information about the practices themselves in terms of what services they can offer, that kind of thing. Sometimes if you've been previously registered with the practice and been asked to leave, you may not be able to apply to register again with that practice, but that is a very exceptionally rare circumstances. Aside from that though, your practice should register you. Sometimes they may ask you for information like ID or previous address information. Whilst they cannot stop you from registering because of not producing that information, it is recommended to do so because it can make the process a lot quicker and easier in terms of making sure you get your healthcare. Other bits of information I do recommend patients sometimes bring is a copy of their repeat prescriptions, if that's applicable, purely because that can make that process easier. A lot of people seem to think that the information on your medical records transfers instantly and effectively, and unfortunately, depending on which clinical system your practice uses, that can or cannot work really well. So therefore, having that information to show can be useful. That sometimes is used in part of what's called a new patient check. Some practices do that, some practices don't. Clearly, it's useful to attend those, and I would highly recommend you do so if your practice offers it, because it's a good introduction to the practice, what information they have, as well as making sure things like your medications flow quickly and easily. However, it's important to recognise that some practices sometimes turn around and say that they can't give you any care until you've had that patient check. That is not true. It is more complicated sometimes if that's not happened, but they can still see you if that's relevant. You may also be registered as a temporary resident, so this is for urgent care over the 14-day period. This is, for example, if you've gone to another part of the country and you need to see services and stuff. Again, that is a temporary resident. That's a different format, and it's a different form that you'll need to fill in, but you can still be seen if relevant. Important to remember, you may not be able to get certain things like medications and stuff. If that's the case, it depends on the information that practices have. Another way you can register at your practice is by using the NHS App. So this is a new app that's come into play this year and is fully available from the 1st of July. And as a result of that, when you use the app, you can register at your local practice quickly and easily. For that, you will need some form of proof of ID, typically photographic ID for the electronic system to register it. And it does work really quickly and effectively to do that. If you want to see more about that, check out our next video that's going to show you how to do that process and also the other services available through the NHS app. But in brief, it's a triage service that allows you to get health information if you want it, as well as being able to book your appointments, get your medications, access your medical information, as well as register preferences for things like organ donation and blood donation, and a couple of other things as well. So make sure you check out that video to see that if you want to. In some practices, you may also be able to access healthcare through other apps, and this is things like the GP at hand model, very similar to the NHS app, very similar process, and it gives you similar sort of information. You may want to check that out if you want to, and if that's relevant. But important to remember, certain practices don't cover all the areas, so make sure you register with the right kind of practice. Again, check out the NHS Choices website for information on that, if that's relevant to yourself. I hope you found this video useful. It's a quick, short one to explain to you how to register at your local practice. Got more information along this lines coming through, particularly covering the NHS app, so make sure you check out those videos as well. And as always, guys, I'm keen to hear your feedback and reviews. Feel free to leave one if you want. You can either leave it in the comments or on our other platforms such as Facebook, YouTube, LinkedIn, Twitter, Instagram, and all the podcasting platforms. Hope you found this useful. And as always, we're here to try and save you and your practice time by tech enhancing your primary care and learning. Catch you in the next episode.